Hello, and welcome to YInstill Reproductive Wellness, world leaders in complementary reproductive medical care since 2004. The following video outlines and summarizes the YInstill 90-day men's treatment protocol to optimize sperm, fertility, and overall health. Because sperm stores regenerate fully in approximately 90 days, we have structured our male optimization protocol with this time frame. The YInstill Male Factor treatment protocol involves acupuncture, supplements, IV therapy, medication, testing, reading, testicle care, nutrition, exercise, things to avoid, sleep optimization, and stress management. Your YInstill practitioner will recommend areas of primary focus for your individual case and support your unique needs throughout the 90-day protocol in order to optimize impact on reproductive potential and overall well-being. Acupuncture. The modern version of this ancient practice is a well-supported adjunctive therapy for male factor infertility. It shows consistent improvements in semen quality parameters, hormonal balance, and sperm structure. Its positive impact on oxidative stress is one known mechanism for which these improvements could be attributed. This is the foundation of our treatments for male factor fertility. One treatment per week for 12 weeks constitutes one course of treatment. Consistency is key for maximum benefit. Supplements. YInstill's custom male fertility formulation Abundance is an important evidence-based aspect of our protocol that includes ingredients to optimize sperm quality and sexual function. Daily administration for a minimum of 90 days is prescribed. IV therapy. A glutathione injection every 2 weeks throughout the 90-day protocol is prescribed, 6 injections in total. It is a powerful antioxidant that is important for the protection and optimization of sperm along its journey from the testicles all the way to fertilization of the egg. Glutathione injections are a quick, easy, and virtually painless way to improve all parameters of sperm in preparation for both natural conception as well as assisted reproductive procedures, such as IVF. It is administered via injection because it is not well absorbed orally. Clomid or clomiphene citrate. Clomid is an oral medication, while primarily known for female fertility treatments, can also be used off-label by men to improve sperm and testosterone levels. Clomid works by increasing the levels of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, in the body. LH stimulates the testes to produce more testosterone, while FSH supports sperm production. A prescription from your reproductive endocrinologist MD or a YInstill naturopathic doctor is required. A dose of 25 to 50 milligrams every Monday, Wednesday, and Friday for a minimum of 12 weeks is typical. Testing. If you haven't already done so, we will recommend lab testing to help determine potential causes and clarify your specific needs for treatment moving forward. At the very least, one semen analysis. Hormones such as testosterone, a lipid panel for basic cardiovascular health, a metabolic panel to assess blood sugar and liver function, thyroid levels, and a physical from an MD or urologist to determine the presence of varicocele is recommended. Testicle care. Avoid heat. This is extremely important. Heat can completely wipe out sperm and affect quality. No hot tubs or sauna while trying to conceive. Showers are okay. If you are feverish, use Tylenol to control your temperature. Ejaculation frequency. When trying to get pregnant around ovulation, ejaculate every 2 days. When not trying to get pregnant, that is, the rest of the cycle, ejaculate at least once per week. Exercise. Resistance training, especially compound movements like squats, deadlifts, or bench presses, can increase testosterone, LH, and FSH, all hormones necessary for sperm production. Exercise in general, including aerobic and cardiovascular training, display many other reproductive benefits. Men who exercise regularly have significantly lower levels of sperm DNA fragmentation and oxidative stress biomarkers. It also improves insulin sensitivity, supports weight management, and lowers inflammation, all of which are linked to better sperm motility and concentration. Finally, exercise improves sleep quality and boosts libido, which indirectly supports hormonal rhythms and consistent ejaculation frequency. Moderate intensity resistance exercise 2 to 3 times each week, and even something as simple as walking 20 to 30 minutes 4 to 5 times each week is highly recommended. Diet and nutrition. Dietary guidelines may be adjusted depending on your specific needs, current BMI, and the type and amount of physical activity that you participate in. But in general, we recommend a primarily whole food, high protein, high fiber, moderate fat, low carbohydrate, Paleolithic Mediterranean style diet. 2 to 3 square meals throughout the day with little to no snacking between meals. Reducing or increasing caloric intake if necessary. Reduce or eliminate processed food. Eating on the go. Alcohol, dairy, deep fried food, sugar and artificial sweeteners. Things to avoid. Toxins in your environment that are known to disrupt hormonal balance and are linked to the declining semen parameters in men worldwide should be known and their use minimized or eliminated. Some of these toxins include ibuprofen or Tylenol, non-organic or processed animal products, plastics and phthalates, especially with number 1 or number 7 on the bottom, household or personal care products that contain synthetic scent, fragrance, or perfumes, dryer sheets and fabric softeners, alcohol, cannabis, of course tobacco, and hair loss products or medications that block androgens. Stress. Stress chemicals and hormones negatively impact sperm production and reduce testosterone levels. A focus must be placed on stress management, and this most often simply means including things in life that make you smile and getting enough rest. Much of the stress we experience is unavoidable. This is why, for the next few months, it is imperative to focus and prioritize joy, passions, hobbies, breathing, exercise, sleep, meditation, friends, love, nature, and anything else that brings smile and laughter into your life. Sleep. Adequate quality rest must be a priority. Poor sleep negatively impacts sperm production and quality by disrupting hormonal regulation and increasing oxidative stress. Aim for 8 hours of sleep each night. In the case of a poor night's sleep, make up for the sleep debt by having an afternoon nap or scheduling sacred time for an uninterrupted meditation. Finally, a book recommendation. In The Way of the Superior Man, Data explores the most important issues in men's lives, from career and family to women and intimacy to love and spirituality, to offer a practical guidebook for living a masculine life of integrity, authenticity, and freedom. It is an easy read with short, simple chapters, each with wisdom to guide you on the journey to becoming a superior man. This is an especially valuable tool as you walk the path to pregnancy with your wife and become a father. In summary, as stated earlier, because sperm stores regenerate fully in approximately 90 days, we have structured our male fertility optimization protocol with this timeframe. The YInstill Male Factor treatment protocol involves acupuncture, supplements, IV therapy, medication, testing, reading, testicle care, nutrition, exercise, things to avoid, sleep optimization, and stress management. Your YInstill practitioner will recommend areas of primary focus for your individual case and support your unique needs throughout the 90-day protocol in order to optimize impact on reproductive potential and overall well-being. If you have any questions, please feel free to reach out to the YInstill admin team or your practitioner anytime. We look forward to working with you on your path to optimize sperm, fertility, and overall health.